Hello everyone, I'm Dr. Sinforian Kambou, a PRM fellow from Cameroon, and I work at the Institute of Applied Neuroscience and Functional Rehabilitation based in Yaoundé, nation capital of Cameroon. In the line of interview series of keynote speaker of the upcoming 𝗟𝘂𝘶𝗵 Congress 2023 in Cartagena in June 2023. Today we have the great honor to receive Professor Luz Helena Lugo, who is one of our keynote speaker and also co-chair of 𝗟𝘂𝘶𝗵 Congress in Colombia to discuss about PRM challenges in Latin America and, of course, discuss about the upcoming Congress. Professor Helena, it's a great pleasure to have you today.
Hello for everybody. My name is Luz Helena Lugo Agudelo. I am a physical and rehabilitation medicine specialist and master in clinical epidemiology too. I have dedicated my life to rehabilitation in my country. I have been a professor for more than 30 years, and I am a teacher from different kind of medical students and for my postgraduate students in PRM. I developed a rehabilitation interdisciplinary unit of PRM in a high complexity hospital, and I attended patients with chronic pain, musculoskeletal problems, and consequences of neurological problems. In the last 20 years, I have been dedicated to research in rehabilitation as a capacity builder with students on PRM and other clinical specialties. In this moment, my areas of research are amputee, cardiovascular problems, traffic accidents, scales validation, and clinical practice guidelines. In this moment, I am one of the two presidents of the next Congress of the 𝗟𝘂𝘶𝗵 2023 in Cartagena.
Okay, thank you very much for this really holistic presentation. And we already have some of your fields of interest and also of your very great and rich experience. This is why we are really glad to have you for this interview today. Okay, so now we can move to the next question. As we are discussing about globally PRM challenges in Latin America, could you just present briefly an overview about rehabilitation in Latin America to start?
Okay, and rehabilitation in Latin America has been strengthened, especially with great leaders who have dedicated their efforts and their lives to promote PM&R in all health fields. Some of them are in Colombia, Lina Mara Batistella y Marta Imamura in Brazil, Graciela Borelli and Hugo Núñez in Uruguay, Gustavo Boca in Ecuador, Carolina Rivera in Chile, Juan Manuel Guzmán in Mexico, and others. And with them and with other professionals to achieve better opportunities for people with rehabilitation needs. We have problems mainly due to the instability of our governments and the lack of continuous policies that allows us to establish long-term national rehabilitation plans. This is our main difficulty I think that in all the countries in Latin America.
Okay, so we can see that there are many figures that work hard so that to implement rehabilitation in Latin America. And this moves us to our next question, because there's the Latin American Medical Association of Rehabilitation, which is a very strong organization, and we would like to know how this organization influence the development of PRM at the level of the region.
This is a difficult point, but for many years, AMLAR has been an association in which all of Latin America associations had been involved, but in the last 3 or 4 years, it has had difficulties. I think due to the possibility of file common goals and with some difference in the engagement, the all with a new generation of PRM doctors. But the leaders continue. In this moment, we have other associations in Latin America who names is SOCILAR. SOCILAR is Sociedad Científica Latinoamericana. And we have other associations very important for the last 20 years. Is SLAP. SLAP means Sociedad Latinoamericana de Paraplegia. These associations and their leaders promote high-quality medical specialistic education and the discussion of the important topics on rehabilitation. For example, United Nations Conventions of the Rights of Persons with Disability, Rehabilitation 2030, a call for action, and recently Global Rehabilitation Alliance, an organization that was founded in 2018. So this organization and the leaders of each country are permanently talking about these topics. In this moment, is very important the virtuality, because we can do webinars with all the people in Latin America, not only in COVID-19 pandemic. If now, yet now, we can have many webinars from all the countries in Latin America.
Okay, so now, according to you, what are the current challenges and perspectives of PRM in the region?
There are many challenges for rehabilitation in Colombia and Latin America. And despite having challenges in some countries, but we have common issues in our countries. For example, to move things forward and intent that rehabilitation becomes a political priority under our health systems. This is a very important goal for our associations. Second, to integrate our associations to obtain common projects in order to develop in our countries the main world proposals of rehabilitation. We need a more unified approach by rehabilitation professionals and subspecialties. We need to develop integrate programs for rehabilitation of persons who experiences or likely to experience limitation in everyday functioning. We need to strengthen the rehabilitation as a health strategy in our health system. For that, we have to develop a national strategy of rehabilitation in the primary care. I think that is one of the main goals of all of the countries in this region. Second, we need to develop integrated programs by multidisciplinary and interdisciplinary teams based on recommendation, based on evidence, with the perspective of patients and their families. It's necessary in all of our countries to have a national plans of rehabilitation. This is very important for integrate all the services at the primary and the secondary and the tertiary levels. We need to have an agenda for development of scientific research and building capacity of research. This is very important to know and to improve the conditions of our health services and to improve the attention of patients with different needs in health. This is some of the goals. Of course, each country has specific goals for development rehabilitation.
Okay, thank you very much. We see that it's a really long-term challenge, to make rehabilitation become a political will and to introduce it at all levels of health system. But we need to continue working on that to achieve this goal. I guess it's the vision, isn't it?
Okay. I think that to get this vision, we need many things. We need to work together, all of the physical medicine and rehabilitation doctors and with other professionals in rehabilitation, and we have to get the health ministers to put on the agenda of the health ministers the rehabilitation. So we have to influence the political decisions with all the stakeholders to get rehabilitation as a part of the health systems in all of levels of the attention.
Exactly. And of course, COVID-19 health crisis was a major outbreak, who highlighted the need for rehabilitation and management of patients. And what was the contribution globally of PRM specialists during this period at the level of Latin America?
Okay, the COVID pandemic was a great opportunity for all the people in the world. I think that in my country and in the region, we have to adapt the services for attending the COVID-19 patients. We have to adapt programs, for example, telerehabilitation, telemedicine, and all strategies and different strategies for attending the patient in critical care, and then the consequences of the COVID. So we have to improve many programs. For example, the cardiopulmonary programs were strengthened in our hospitals. The other strategy was to do the research about COVID. We did different systematic review and systematic rapid review and systematic living rapid review about COVID in children, in older people and adults. We have to we did a systematic review for Cochrane rehabilitation about telerehabilitation and home base, and it was very important for us and for other people in Italian and in Norway. Okay. So this kind of research was very important for our group and for all in Latin America. Different groups in different countries did research and adapting their services, their rehabilitation services for this pandemic. And this situation generates in all of us the learning and an important learning for the practices of rehabilitation.
Okay. Thank you very much, Professor Helena. And now we are just reaching to the end of our discussion. But to conclude, as co-chair of ISPRM 2023 in the Congress in Cartagena, can you give us a word on some innovation for this major event and why it is important for ISPRM community or all PRM community to attend the conference in June in Cartagena?
Okay.
I guess that Colombia is really excited to host the Congress in 1 month and a half, something like that.
Yes. Okay. I first, as one of the president of Congress of Cartagena ISPRM 2023, the other president is Dr. 𝗿𝘂𝘍𝗶. He is from Cali. Okay, we are the two presidents of this meeting. And as one of the presidents, I want to invite all of the physical medicine and rehabilitation specialists in the world and professionals related with rehabilitation. First, to get to know this beautiful country with great natural and human contrasts and a great cultural richness in all regions. This is the first point. Second, we find ourselves, listen to each other and talk to each other colleagues from all the world, from different countries, to understand how rehabilitation is lived and thought in the different regions of the world. This is the second more important point for to meet in Cartagena. And third is to know and to share the new knowledge and practices of PM&R in different health conditions, clinical science, specific groups, PM&R diagnosis, advances in engineers, technology and therapeutics, health policy systems, and especially development. I think that these are the key points of this meeting in Cartagena on June.
Okay, thank you very much. I see that you are really excited, and certainly most of the PRM specialists all around the world will attend the meeting, and I'm sure, and I guess I'm sure that it will be a really great event for PRM all around the world. So thank you very much, Professor Helena, for attending this discussion. It was a great honor to have you today, and we are very glad.
Thank you, and we wait for all of you in Cartagena on June.
Okay. Thank you very much. Okay, thank you very much. We take care of you, and then certainly meet you all in Cartagena in June. Bye bye. Ciao.